Hey there, I am Amy Hare and welcome to my podcast. We've revamped it. If you had listened last year, you'll notice it's a little bit different now. We are brought to you by Carla Wellness. As always, we are powered by them. If you want to live life limitless, check out Carla Wellness. It's currently open in Townsville. It is a franchise. So if you are interested in looking at the business, then head to the website www.carlawellness.com.au. It's Kala Wellness. Check out all the social media pages as well for any extra information. I have the absolute pleasure of talking to absolutely amazing human beings. And I know I just said absolutely twice there, but you know what? The people that I get to speak to truly are amazing. I speak with people who are making an impact in the world in a really positive way. I speak to people who are making it their life mission to create positive change in the world in whatever area or whatever field they're a part of. And it's really exciting to get to speak to people from all walks of life, people who are doing all sorts of different things, people who are marching to the beat of the same drum that I am, who are just out in the world really trying to create a positive impact and see people smile, see people change their lives. That's a really big part of why I do what I do. And I get to share stories of people who are out there creating the same thing. So enjoy. I hope you take something away from it. I hope you find some value in what it is that we put together. And as always, if you have questions or if you have someone that you really want me to speak to or reach out to, then send us a message and let me know. Hey guys, thanks for joining me. My chat today is with someone that I'm a huge fan of, because if you followed my social media at all recently, you will know exactly what I mean when I say I'm a huge fan of his work, because he fixed my belly and I'm going back in a few months to get the rest of my mummy makeover done. He's putting my boobs back where they belong. If you're a mother, you'll know exactly what I mean. Dr. Andrew Broadhurst, he is a plastic surgeon in Brisbane. Absolutely amazing. And look, I'm no stranger to plastic surgery or cosmetic surgery. And by far, he's the most warm, friendly, and amazing surgeon that I've ever come across. So it was a real pleasure to get to share some time with him while we had our chat. Now, Andrew is a specialist plastic surgeon. He specializes in breast, body, and rhinoplasty procedures. He's been in the industry for over 20 years, and a really interesting part of our chat was when he actually told us that plastic surgery wasn't what he originally wanted to go into. So it was really lovely to get to share that time with him. We did say after the chat that we'll catch up again. And you know what? I would really love to get to know him as a person rather than, talk about cosmetic procedures, because I think, there's a lot of value in learning about the person behind the brand. So hope you enjoy it. Please feel free to share it. And if you've got any questions at all, please post them in the comments. This is just a chat. So as always with these things, if you've got any questions, concerns, or anything like that, please send it over to Dr. Broadhurst's team. If you're looking at having a procedure done, I highly, highly recommend him, obviously. And I really hope you enjoy this chat. So today I am joined by a very special guest. I'm actually really excited to have him here with me today, Dr. Andrew Broadhurst. Now, if you've followed my social media, you will see that this is the man who's recently done my tummy procedure. I'm going back to see him in June to get my, boobs fixed after kids suck the life out of them. So I'm really excited to have a chat with Andrew today. How are you?
Very well, thank you.
Thanks for joining me. No, thanks for coming along. I know that you're a very busy man, so I really appreciate your time. And I know that there are a few people who have sent in some questions who are really excited to get a chance to have a listen to you. So thank you.
Pleasure.
I like to start all of these podcasts or interviews, if you will, with a little bit of history. So can you fill us in? You're in Brisbane. Are you a Brisbane local? Are you born and bred in Brisbane?
All right. Born in Adelaide. So I grew up in Adelaide. I went to medical school in Adelaide. I left Adelaide pretty much as soon as I could. I worked in most capital cities in Australia. I've worked in Melbourne for a couple of years. Worked in Brisbane. I did work in Adelaide. Worked up the north coast of Queensland. I worked in Mackay. I did my plastic surgery training in Melbourne and in Brisbane. And after plastic surgery training, I went to England, and I worked in England for 3 years.
Oh, wow.
And then came back to Brisbane, and I've been in Brisbane now since 2005.
So that seems like quite a long, I suppose, career so far, and you are quite young. Do you feel like sharing how old you are?
I'm 54.
You're 54. Well, you look much younger than 54. So what, like you said about, you did your plastic in Melbourne, did you say?
Yeah, so about half of my plastic surgery training was in Melbourne.
Yeah.
And that like an unofficial exchange between Victoria and Queensland. So then I did 2 more years training in Queensland, and then did what's called a fellowship, which is kind of a little bit more training, but under less supervision in England. Then I worked there privately for 2 years.
Oh, wow. Okay. So what's the difference between cosmetic and plastic surgery? Are they one and the same?
No, no, they're very different. So this is a question that comes up a lot.
Uh-huh.
And, a plastic surgeon is someone who has got a medical degree, and plastic surgery training is a little bit different now to when I did it. But when I did it, you had to do an intern year. So there's 1 year. You had to do 2 years of what's called basic surgical training.
Yeah.
And then you would sit an exam, which is kind of like an entrance exam to plastic surgery training. Then you had to do a year of surgery in general, and then 4 years of plastic surgery.
Okay, so quite a bit.
Slightly different now, and the program's now down to about a 5-year block. But there's an entrance exam, there's an exit exam, and if you don't pass those exams, then you don't make the grade.
Yeah.
And that, I suppose, that the body that does that governs the exams is the Royal Australian College of Surgeons. So all plastic surgeons are members of the Royal Australasian College of Surgeons. And then a lot of us then become members of other societies, for example, the Australian Society of Plastic Surgeons. And a cosmetic surgeon, and by definition, to use the term surgeon, you have to be a qualified surgeon. So in Queensland, for example, it's illegal to use the term surgeon unless you're a member of the College of Surgeons. So there are a lot of people who call themselves cosmetic surgeons who aren't members of that college. And that's when the term cosmetic surgeon comes in. So those are people who have a medical degree, absolutely, but then have done further training, but it's not under the auspices of the College of Surgeons. So technically you could go away and do some overseas training for a year, and then come back and set up and call yourself a cosmetic surgeon, and you can do breast augmentation, for example. That's a common procedure that cosmetic surgeons would do.
Yeah.
It's just, and what's the real difference? The real difference is training.
Yeah.
A plastic surgeon has had anywhere from sort of 5 to 7 years more training, and what that really gives you is it gives you a breadth and depth of experience that you can't get, in a year.
Mm-hmm.
And also it's a much broader range of experience.
Yeah.
So plastic surgeons do all sorts of things. I used to work at the Children's Hospital doing cleft-lip and palate surgery.
Yeah.
They do burn surgery, they do hand surgery, they do breast reconstruction, they do cosmetic surgery. So there's a whole broad range of procedures that plastic surgeons would do. Cosmetic surgeons, typically, it's breast surgery. Some of them do liposuction, some do, what else do they do? I suppose tummy tucks occasionally. But they do it from a pure cosmetic point of view. Whereas the other thing that plastic surgeons would do was they would take into account the functional components.
Sure.
For example, rhinoplasty, you can change the way your nose looks, but you can also change the way your nose works, i.e. how you breathe.
Yeah.
And a plastic surgery is much more likely to address both of those issues.
Yeah. Okay. Has it been something that you always wanted to do? Were you from a young age, that's what I want to do with my life?
No, I've kind of grown into plastic surgery.
Okay.
So early on, I love sport. I wanted to do something in the sports medicine field.
Okay. Did you play sport?
Yeah, I played sport, and I mean, I was particularly interested in, I suppose, the physiology, of sport, how you run faster, why someone's stronger than someone else, all those sorts of.
Yeah, cool.
So I thought, well, sports medicine, you need to do medicine, and then I'll get involved in the sport component. And then I quite like surgery through medical school. So I figured that orthopaedic surgery was the closest thing to sports medicine. So I embarked on a career in orthopaedic surgery, and then found out it really wasn't what I was after. I didn't really like too many parts of orthopaedic surgery.
Yeah.
But one of the things in Queensland that orthopaedic surgeons did was hand surgery.
Okay.
So that's the part of orthopaedics that I like the most. And I was working back in Melbourne then, and in Victoria, pretty much all at the time, all hand surgery was done by plastic surgeons.
Yeah.
So I went, well, if I want to do hand surgery, then I've got to, have a look at this thing called plastic surgery. And really, I didn't know that much about it.
Okay. Yeah.
So I went down that pathway, and then found out that plastic surgeons actually do lots of stuff that's pretty cool. And to start with, it's just skin cancer surgery and hand surgery, hand trauma. Free flap surgery, which is taking pieces of tissue from one area of the body, moving them somewhere else, joining up the blood vessels, and that's a revolutionary procedure, and something that now is it's common plastic surgery day in, day out, and that was fascinating. And then you start plastic surgery, and it's like all things, you evolve. And then I got interested in cosmetic surgery, and now I probably just do breast and nose surgery.
What's your favourite?
It's a tough question. It depends on the day.
Yeah.
I think noses are probably my favourite, but nose surgery is really time-consuming. It's very intricate, and the attention to detail in terms of, half a millimetre makes a difference, like a big difference, potentially, the tip of your nose might look like. So there's times that appeals, but there's other times where you just don't want to have to work that hard and concentrate that hard.
Yeah.
And, so breast reduction, I suppose, is one of the other things that I really like.
Yeah.
And I suppose for slightly different reasons. People have a breast reduction, typically have large, droopy breasts, that it interferes with everything you do.
Yeah.
What the clothes you can wear, the activities you can perform. And you have breast reduction, and you come out of that, and you have smaller breasts, they sit where they're supposed to. You don't have to worry about what clothes you're going to wear, because you can buy any bra off the rack.
Yeah.
And that's a little bit dramatic, but it's a life-changing kind of procedure.
Absolutely. I can't tell you, it's been 10 years now that since I had my first baby, and I remember the moment looking in the mirror at my body after giving birth, and I was like, no one told me that this is what I would be left with after. I used to model, I used to cheerlead, my body was, and I've been an athlete, so my body was in peak condition to just have a baby. And I also had a mother who was like, you need to eat double now because you're having a baby. And I'm like, well, I've never had a baby before. Okay, I need to eat double. So I put on so much weight. And then the kind of after result, I was like, what do I do with this? Like where they don't sit where they used to sit. And it got to that point where, I get cuts on my back from wearing a bra that doesn't sit properly because everything's so heavy. And exactly what you're explaining, I'm feeling, because they are in the way. They don't sit properly. They don't do as they're told. They move around too much and they hurt.
Yeah. So, I mean, that's a procedure that, pretty much everyone who has that procedure comes out the other end going, best thing I've ever done.
Yeah.
And should have done it ages ago. And, it changes how you live your life. Now, having your nose operated on and getting rid of the bump on your nose, for example, or straightening your nose that was really bent previously,
Mm-hmm.
It's different. The change is different,
Yeah.
Not saying it's any more or less profound. It's just different.
Yeah. Yeah. Do you have so that's the reduction. What's the lift? Do you do them both at the same time? Is it different procedures? Can you do one without the other?
Yeah, that's a good question. So a breast reduction, in really general terms, is really two things. It's one, making your breast smaller.
Yeah.
And two, it's reshaping and repositioning your breasts so they sit higher on your chest.
Okay.
And I suppose the way I look at that is, and I do this for all the patients that I see, in their pre-op consult, we draw a line on your chest, and that line corresponds to the fold under your breast.
Mm-hmm.
And I take a photo of that, we put it up on the screen, and I go, here's a photo of you, and here is 40% of your breast tissue sitting below the fold under your breast.
Mm-hmm.
And for argument's sake, your nipples sit below the fold.
Yeah.
So 40% of your breast tissue below the fold, nipples sit below the fold. Nobody really likes that shape, okay?
Nope.
And in addition to that, they're big, they're large breasts, they give you neck pain, shoulder pain, rashes, you have all those problems. So in one operation, we're going to make your breast smaller, and we choose a size, or kind of, I suppose that's a joint sort of process. We talk cup sizes, A, B, C, D.
Mm-hmm.
But more importantly, I think I show everyone photos of before and afters, and I say, look, while you're looking at these photos, look at the shape, look at the size, look at the scars, look at all those things. But really importantly, look at the shape and look at the size, because I want you to tell me which sizes you like. I like that. I like that one. And that's much more useful information for me than saying I want to be a C.
Yeah.
Because what you think is a C and what I think is a C, they might be quite different.
Sure.
We're both looking at the same photo, and it's a breast reduction. Then, firstly, I've done that operation for that person, so I know how to do it.
Yeah.
And we're both looking at the same photo. It doesn't matter whether it's a C or a D, really. So what we're after is a smaller breast, and that's how we work out roughly how much smaller we're going to go.
Mm-hmm.
And secondly, you want all your breast tissue sitting above the fold under your breast.
Yeah.
We want your nipples in the middle of your breast.
Yeah.
We want your breast to look round. So, if you look at a classic breast reduction, someone that's got big breasts, they're very oblong in shape.
Yeah. Yeah.
And they probably didn't start out that way, but that's how they finished.
Yeah.
And what we're trying to do is give you a round breast shape. So from the front, they look round. From the side, they look round. All your breast tissue is above the fold, and your nipples are in your breast.
Mm-hmm.
So a breast reduction in that sense, I suppose, is a reduction and a lift.
Yeah.
But conceptually, it's just one operation.
Sure.
So it is a really common question. Someone will say, am I getting a lift with my breast reduction? The answer is they're one and the same. They go together. I can't imagine you'd ever do one without the other.
Sure. Yeah.
But I suppose on the flip side, you can do a lift where you don't really make your breast smaller.
Yeah.
So in that sort of procedure, you're using your skin as a bra. So it's a tightening procedure. You make everything really tight. You lift your breasts, put your nipples back in the middle of the breast. So you're reshaping your breast, but you're not really changing the shape.
Okay.
So you're not changing the size.
Yeah. So can people have fat, like have liposuction in, say, their legs and put the fat in their boobs?
You can, yes. So I suppose going back to that, the other thing that we occasionally do for people where they've got a high fatty content for their breast is you can do liposuction to your breasts.
Oh.
Again, it's going to make you smaller, not going to make your shape better necessarily, but
yeah,
you can do liposuction to your breast to reduce the volume.
Sure.
More recently, fat transfer has become popular, and that's a procedure in which you take fat from somewhere else, you modify the fat, you put it through a processing system, and you re-inject the fat somewhere else.
Yeah.
And conceptually, it's a fantastic idea. Let's take fat from my bum where I don't want it, and let's put it in, the upper pole of my breast where I do want it.
Yeah.
The reality, it just doesn't work that well.
Sure.
So in concept, fantastic. In reality, it's still good for your bum. Your bum's going to be a bit smaller because it will remove some fat.
Yeah.
Your breasts, not all the fat survives. It doesn't. People are looking at as an alternative, I suppose, to breast implants.
Yeah. Let's
put some fat in. It's natural. It's my fat. It's not an implant, which is something foreign.
Yeah.
But it can't even come close to giving you the result that an implant's going to give you.
Yeah. Yeah.
But yes, we do it. It's more I suppose, an ancillary procedure or an adjuvant procedure. So you put an implant in, and someone who's super slim, you can see the outline of the implant a little bit, and you just want to camouflage it. Now, that person could, potentially go away and put on some weight, and the implant will be less visible, but most people don't want to do that. Yeah. So we can take fat from somewhere else and just put, a thin volume of fat over the edge of the implant to kind of hide the edge of the implant.
Sure. So could someone have an implant done at the same time as having a reduction, or is that something that happens later?
So one procedure we do as a combination is putting an implant in and doing a lift.
Oh, sorry, yeah, a lift more than.
So if you're doing a reduction, this the way I explain it to people, breast reduction is interferes with the blood supply to your breast tissue quite a lot.
Okay.
And, some of the risks of breast reduction include, wounds not healing because the blood supply is not good enough. Sometimes tissue doesn't survive. So the procedure itself is quite destructive to the blood supply of your breast.
Sure.
And you can't, at the end of doing that, even though many people would like one, you can't then put an implant in, because the act of creating the pocket for the implant interferes with the blood supply even more. So now you're in a position where you're going to have likely to have an inadequate supply to the breast or your skin or your nipple. Yeah. And if you get into that position, then something's not going to survive, and you can't be there.
Yeah.
So we occasionally would do a breast implant with a lift.
Yeah.
And every plastic surgeon has kind of different criteria they would use as to when you would do that as a one-stage procedure, i.e. both together.
Yeah.
Or a two-stage procedure where you would do, for example, you do a breast lift first, and then you do an implant second.
Yeah.
And it's all about safety. If you can safely do it in one procedure and get a good result, then you would.
Mm-hmm.
But if it's not safe because, for example, your nipples sit way too low on your chest, they have to move too far.
Mm-hmm.
Most people would say, look, if they've got to move more than maybe 5 or 6 centimetres, then the risk to the blood supply is becoming significant. And again, you don't want to be in that position. So let's just convert it to a two-stage procedure. Much safer. And probably you get a little bit better result. It's a bit more predictable.
Yeah. Okay. One of the things I really want to talk to you about is one of the, I suppose, negative comments. Like, and I've got so many positive comments. I love what I've had done, but I've had a few people, say that it's vain to go and get a cosmetic or a plastic procedure done. And I suppose in the past, I probably felt that, and being very young and naive, I had my nose done 12 years ago now. So I was, hang on, how old was I? I don't know, 12 years ago. How old was I? 23. So I was, 23 when I had my nose done. And I think back then I probably thought, believed the perception that it was vain. And now I look at it and go, this has given me so much more than just appearance. It's, you know, my tummy, my abs are back together. I feel strong again. I feel like I can stand up straight. My nose, you know, I got so much confidence out of having that done, and my belly. I've had so much, just this massive boost of confidence having had it done. I've always used to live in bikinis, and I was so self-conscious of showing my belly after having babies. And as much as my kids thought it was cute that they'd come up to me and poke my belly and they go, "I love your fat belly, mummy," and I'm like, "I don't love it." They thought it was great, and I was going like, "No, get rid of it. This isn't me." How do you feel about comments like that? Because I know now it bothers me when people just go, "Oh, that's just so vain," or "I'm not vain enough to want to get, you know, plastic surgery done."
Yeah. Several comments. One, I think, you know, and the most important thing is, and I explain this to people, is you have to do it for yourself.
Yeah.
No, you're not doing it because people are making comments directly, maybe indirectly.
Yeah.
Doing it necessarily just for your part. You're doing it because you want to have it done. So I think that's the first thing. And you know, seriously, anything that makes you feel better about yourself is worth doing. You know,
Absolutely.
And you know, if we just go back to the breast reduction kind of, you know, analogy, it's a life-changing procedure, and in that sense, there are what we call functional issues. So you have pain, skin rashes, and you know, not many people would say, "Look, you're being vain," because you don't want to have pain in your neck and shoulders, and you don't want to have skin rashes.
Yep.
But it falls both under the cosmetic surgery and the reconstructive surgery sort of umbrella. So, but then you get something like a breast implant, for example, and you know, there are all sorts of people who have breast implants, and they have them for all sorts of reasons. And you know, if you were, I don't know, 19 or 20 and you have almost no breast tissue whatsoever, then you're going to stand next to your friends and they're going to have a range of breast sizes, presumably.
Yeah.
And, you know, you just feel different. Everyone's going to feel connected and part of the group.
Yes.
And again, does it really make you any different the fact that you don't have breasts? No, it really doesn't. But it might make you feel that way. I used to have lots of arguments with people about cosmetic surgery and, you know, why are you doing that? You shouldn't be doing that. You know, you're supporting those people who are vain.
Yeah.
And I had a couple of arguments. One was there kids were born with ears that stick out, bad ears, is the term we use.
Yeah.
And most kids with really big ears that get teased at school would have an operation to have their ears set back. And that is a completely cosmetic procedure. There's that's all it is. It's just changing the way ears look.
Yeah.
And the vast majority of people would say that's okay. That poor kid was getting teased at school.
Yeah.
Now they've got their ears fixed. Now they're not getting teased. And you know, is it different because it's in a kid versus an adult? And we would do it in adults as well, but no, probably not. But no one says that kid's vain.
Yeah, true. Honestly, if I could have had my nose done when I was 12, I probably would have had it done. I have my heritage is Italian, so I had the big and I got called Pinocchio at school, and it was horrible. And I remember one day I was late, and it stuck with me. And I always, since that day, I was like grade 7, and I was late for school, and this one craphead child was like, no, she was here 10 minutes ago. Her nose was already at school. And ever since then, I was like, no, I'm having my nose done. And as soon as I could, I went and had it done, because it was just that thing. I got picked on. There was nothing else that I think anyone could have picked on me for, like, you know, had to go at me about. And it was that, and it was right there in the middle of my face. And I was so self-conscious of it. And yeah, I wouldn't have said that for me, you know, as a 12-year-old getting picked on because of the size or the shape of my nose, that was vain. You know, and like you say, the functionality. Before I had my abs done, I'd gone from being very strong in my core, to not even being able to hold a push-up position or a plank position or do a sit-up properly. And I couldn't run properly, and running is my thing. I love to run. And I just had this horrible rotation in my hips that I would have sore hips, and then I would have sore legs, and then my abs would hurt, what was there. And I felt that I was in this phase of really justifying myself to people when I spoke about it. And I hate justifying. I'm very conscious now of, am I going to justify myself to this person or not? And I just felt that I was in this routine of justifying why I wanted to have this thing done, and saying, no, it's not vain. I'm in pain constantly. I can't do the things that I would normally do because of the separation in my abs, because of the size and shape of my breasts. It was just, yeah.
I think, there's a lot of stigma attached with cosmetic surgery. And I don't really know where that comes from, to be honest.
Yeah.
But long-standing. And I work in the industry and I have done for 20 years.
Yeah.
And we still say, when I say we, it's either me or someone in my office or someone in the operating theatre or something. You'll be talking about someone, you'll see a photo of someone in social media or whatever, and you go, oh, she's had some work done. And seriously, that's not a positive. It's like, it doesn't, the comment is not, look how fantastic she is. It's usually, oh, she's had some work done.
Yeah.
And I just say, and, that's not a bad thing. If the result was bad, okay, that's fine. But just because someone's, had their lips done or had their nose done, or had their boobs done, it's, the social stigma is enormous, and still is. I think it's, it's more, people are more accepting, but, and I think people who have had a procedure done, they're in your position where they go, look, this is the best thing I've ever done. Yeah. Not for everyone, but people have had stuff done, it makes a big difference. Going back to the breast reduction, I see, I did see when I worked at the Children's Hospital, occasionally we would see 13, 14, 15-year-olds with breasts down past their belly button.
Wow.
Now, if you're a 15-year-old girl at school, trying to go to swimming carnival, whatever it might be, breasts that are down to your belly button, life's tough. It really is. It's really tough. And if you can have, there's a whole bunch of issues, about operating in teenagers. And in Queensland, you can't operate on someone for cosmetic purposes until they're 18 years old.
Yeah.
But in that situation, it's not a cosmetic procedure.
Yeah.
Yes, we're changing what their breasts look like, but it's a functional thing. You can't run, you can't play sport.
Yeah.
Do dance.
You're improving their quality of life.
And, doing an operation on something like that changes. That does change their life. It really does.
Yeah.
And, when you get to talk to them, it changes who they are. They've gone from being, I used to love dancing, I used to love swimming on family holidays, I used to go running for exercise with Dad in the morning. And with breasts like that, you can't do any of that stuff.
Yeah.
You don't want to leave your room.
Yeah.
Definitely not going to the beach. Swimming carnival at school comes along and, you're
it's
off
traumatic.
sick. Yeah, you're off sick.
Yeah.
And you're not going running with Dad in the morning because you can't run anymore. You can have an operation and you can pretty much convert, unmanageably large breasts to normal breasts.
Yeah. Yeah.
And you can have a normal lifestyle. You can go back to swimming carnival, you can go running, and you want to go back and join the dance team. You can do all those things. Does that make it vain? I don't think so.
No, I agree with you. Is there a point where it goes too far though? Is there a point where, have you ever had someone come in and they just want really, really big boobs and you just go, look, that's just not what I do?
Yeah. So, everything exists on a spectrum, I suppose. And,
yeah. Because, we've all watched Botched.
Exactly. So, I think one of the reasons why breast implants, for example, or having your lips done
Mm-hmm.
have a stigma attached to them,
Mm-hmm.
is because you see the excess.
Yeah.
So there are a lot of people out there with breast implants,
Mm-hmm.
and most people would probably have friends who have breast implants, and they don't know.
Yeah.
Okay, you don't know, one of your friends has got breast implants because they're a normal size and they're normal shape, and maybe that's just giving them back what the kids took away, so to speak.
Yeah.
And because they're proportionate in size, you can't really tell.
Mm.
So you don't know they've got them. But when the next person comes along and they've got 800 million implants, and they sit up here and they wear skimpy tops, of course everyone can tell that they've got breast implants. So people then start to create an impression in their mind of, if you have breast implants, that's what you're going to look like.
Yeah.
And it's a really common comment. People come in and go, I want to restore my breast volume, or I've got tiny breasts, I want to be a little bit bigger, but I don't want to look like, and they list off a bunch of people
Yeah.
who've got, unmanageably large breasts.
Yeah.
So I think, there are people who want to go too big. What do? I just go, look, I can't do that.
Yeah.
There's loads of people who will, but
yeah,
I'm not doing that.
That's not your thing.
No, and likewise, I do lots of noses, and people come in with all sorts of nose sizes and shapes, and got a big bump in your nose, or you can't breathe through your nose. That's kind of a no-brainer. You can make a big difference,
Yeah.
and that's worth doing. But some people come in and the rim of one nostril is a 0.5 millimetre higher than the other one.
Yeah.
They want you to fix that, and you just go, look, seriously. I go, look, in terms of millimetres, the change that we're going to make in an operation like that is less than 0.5 millimetre. Nobody can notice that. They really
Yeah.
And that's not a surgical problem. That's a psychological problem. And maybe that's being a bit harsh, but that change is so small that no one's going to notice.
Yeah.
The person themselves might have trouble noticing that bigger difference. So that's a smaller difference. And can you do that for someone? No.
Yeah.
That operation, I say that operation is not in your best interest.
Yeah. Okay.
It's great for me. I'm a surgeon. I love doing operations.
Yeah.
But it's not in your best interest.
I think that's the difference, though, where essentially a duty of care comes in. When people expect precision perfection, sometimes that's just not achievable. I like to say it's perfectly imperfect. If it gives you what the desired result of, you feel better within yourself, and that's something that's achievable, then that's a win. But I think sometimes I don't know. I think sometimes people are so heavily influenced by this idea that everything needs to be millimeter perfect. And I think that's just not real.
No, I mean, we have lots of phrases in plastic surgery, and one of them is, people want their breast, they want two breasts that are exactly the same size and exactly the same shape.
Mm-hmm.
I understand that completely. I mean, if I was a woman, that's what I would want too.
Yeah.
But, that's not realistic because, well, firstly, there are very, very few people, naturally on the planet who have two breasts that are exactly the same size and exactly the same shape. They're just doesn't happen.
Yeah.
So, the phrase we use is, they're sisters, not twins.
Yeah.
You have two breasts, they're going to look very similar.
Yeah.
And they're just not going to be exactly the same.
Yeah.
And most people spend most of their time with clothes on.
Mm-hmm.
And, if one nipple's 8 millimetres higher than the other one, you can't tell that with clothes on. You really can't. And even with your top off, the only way you can determine that, nipple height discrepancy is to stand with your shoulders level in a well-lit room and either have a photo taken or stand still in front of the mirror. And that's not normal. People don't do that.
Yeah.
Yes, it would be ideal, and that's our aim, obviously, exactly the same height. But we're not perfect, and life's not perfect. So it's much, much better. It's just not perfect.
Perfectly imperfect.
Yes, exactly.
Yeah. Have you had any, really complex cases through? Have you had anything that, has even shocked and surprised you?
Oh, no, nothing ever surprises. Let me think. Come back to me on that one, and I'll.
Okay. we might have to let you have a good old think about that one, and we'll do a follow-up, and you can talk to me about the crazy ones that you've had. If someone came to you and they wanted to speak to you about having a procedure done, what's the process that they go through?
So normally someone's called the office or sent an email inquiry, and the girls in the office will respond to that, and it's usually just simple questions, who are you, where do you live, what do you want done?
Mm-hmm.
And then at the moment, and this is all post-COVID, usually our first kind of port of call is like a telehealth. It's either over the phone, a Zoom, FaceTime, whatever it's going to be.
Yeah.
And we can get pretty much all the information. I can get all the information I need from someone, either over the phone or via Zoom or FaceTime.
Mm-hmm.
And advantage of that is you don't have to leave your home.
Yeah.
Normally people have sent some photos through. So if it's, for example, your nose, we
Mm-hmm.
have a standardised group of photos that you would send in. Breast, same thing. So what it really means is you can have your consultation without driving half an hour in the rain, trying to find somewhere to park. And then for breast in particular, those people are thinking, I'm going to have to take my top off in front of some strange guy, and people just don't remember what you say.
Yeah.
They're so anxious that that's all they're just sitting here thinking, going to have to take my top off soon, going to take my they don't retain the information that they're getting.
Yeah.
And I know this because women who come in with a partner will then come back for a second consult, and they'll have a whole list of questions.
Yeah.
And the partner will go, they'll list off question number one, and the partner goes, he told you that last time. And so we go through the answer. And after a while, it became clear that the partner remembered everything.
Yeah.
He's not taking his top off. He doesn't have that emotional involvement. So if you can have a phone consult or a FaceTime where you're sitting at home, you can have a cup of coffee, you can sit out on the back deck, you do whatever you want.
Yeah.
I've already got your photos, so you don't have to take your clothes off or do anything like that. And then we can just talk about the procedure that you're after, a little bit of why, and then what's your general health like, just to make sure that, you're fit and healthy and you can tolerate a surgical procedure.
Yeah.
And then I give people a rundown. Here are your options. So firstly, what don't you like? Kind of make a list. These are things we don't like. What are you after? Make a separate list.
Mm-hmm.
And then how do we get from one to the other? Well, there's three options. There's three different operations you could have, or there's one, or there's some variations. And we kind of run through the pros and cons of those. And the only thing that's difficult over the phone or Zoom is showing photos.
Mm.
And that's really helpful because you can go, look, for option A, here's a before and after. For option B, here's a before and after. And they go, oh, well, I don't want that one. I want that one.
Yeah.
And showing photos is really helpful. It helps people. There's lots of visual people out there.
Mm-hmm.
And all of a sudden, you can see something and you can understand it. But, if I sit here and rabbit on about the fold under your breast and breast tissue being above and below, some people they can't follow that.
Yeah.
You show them a picture, straight away they know exactly what you're talking about.
Yeah. I know. I think that was one of the first things I said to you when I had my phone consult with you was, well, that was awkward. I had to send naked photos to you. And for you, it's probably just, a boob's just boobs now. Have you seen so many that it's just like, oh, they're just breasts, they're just tissue?
Yeah, I suppose at work, boobs are just boobs. It's almost like it's the problem list. Here's the problem list.
Yeah.
What we're after and how we're going to get there. That's the philosophy, I suppose.
Yeah, it just becomes part of what you do every day. Yeah.
So yeah, that's the first port of call, and really it's an information exchange. I get information
Yeah.
that helps you work out what the options are.
Mm.
The patient gets a whole bunch of information, and the next step from there is go away and distill all that information. And I do that, and I make some notes. This is what I was thinking. These are my plans. This is why. And the patient can go away and think about their options. What are the implications? Time off work, what I can do afterwards, all those sorts of things.
Mm-hmm.
And then, usually based on that first one, we can give someone really general information about procedures, pricing, and the next step would be, the second consultation, and that would normally be a face-to-face one.
Mm.
And that could be a couple of weeks down the track, it could be a couple of months down the track, but enough time has to elapse that you kind of processed all that information.
Yeah.
And you've decided that, yeah, this is definitely what I want to do.
Yeah.
Because if it's not, and I tell everyone this, I said, if you're not sure, much better not to have an operation.
Yeah.
You can have one later, you can change your mind again, have one later.
Yeah.
But you don't want to be in the position where you had an operation and they went, yeah, wish I didn't have that.
Yeah.
So I think time's really important. So enough time has to pass from the first consultation to the second, and then from the second to the operation, that you've really thought it through.
Yeah.
And the other thing we say is it's not a haircut. You get a bad haircut or a bad hair color, you can grow it out, or most people grow it out, or you can change it. Okay, so it's going to change. But you have an operation to make your breast big, or you make your breast smaller, or change your nose. Can't really change that.
Yeah.
It's got to be really sure.
Yeah. Yeah. Mm. And lastly, something that I really like about you is, aside from your bedside manner, because I've, spoken to other surgeons in the past, and they're very matter of fact, very just, this is just business and let's get down to it kind of thing. And I like that, you're very kind, you're very approachable, and you're very easy to talk to. But there's something that I like about you that's really special, and you're very involved in community, with charity and that sort of thing. And I guess I wanted to touch on, why is that? What is it about, being involved in those sort of things outside of what you do that means something to you?
I think when you go to medical school, and then you become a doctor, one of the reasons you do that is because you want to help people. And on that journey, you see so many unfortunate people, and whoever you help, and in whatever way you help them, and it's not always the case, but most of the time, those people are unbelievably appreciative.
Yeah.
And that's one of those things that, didn't matter how much money you charge for that operation, or how long it took, or what you missed out on, what you could have been doing. When someone comes back and, is appreciative, and, you've changed my life, or I don't have neck pain and shoulder pain, or, for noses, someone pulls a camera out at the party, and I used to run away because I didn't want anyone getting a photo of my nose from side on, sort of.
Yeah.
And then all of a sudden that's gone, that makes you feel good.
Yeah.
I mean, that's why I do it. I think, I used to do cleft lip and palate surgery, and, obviously kids born with a cleft lip and they've got a big hole in the lip, and they look unusual. They really do, And same deal in one pretty short operation, at the age of 3 months, you can fix their lip. You can't always fix their nose completely, but you can transform them, if you like, from someone who everyone would notice when you've got a big hole in the lip, to, it's not perfect, but it's pretty close.
Yeah.
And, then really no one notices.
Yeah.
I tell, especially with nose, I tell lots of people, I say, what we're trying to do with your nose is we're trying to change you from someone who is nose focused, and, maybe their nose is really big and it's got a really big hump on it, okay? And if you show someone that photo, everyone's attention goes to the nose. You can't help it. It's such a big nose.
Yeah.
And because they're kind of outside of the normal box, if you like. And what you want to do is you want to put them in the normal box so that no one notices their nose and they don't notice their nose.
Yeah.
And so I tell people, so look, if you're walking down the street and someone who's 7 feet tall walks past you, you're going to notice them, okay? And not that that's good or that's bad. You just notice them because they're much taller than everyone else, okay? They're outside the normal box, if you like. So if you've got a big nose or you press it down to your belly button, you're kind of like that person. You're outside of the normal range. And if you can do an operation that puts someone back in the normal range and they're happy with that, that's a winner.
Why wouldn't you? It's just like anything else. Why wouldn't you help someone to feel better about themselves and give them that quality of life that, I think everyone wants that. Everyone wants to be happy. Everyone wants to be accepted. Everyone wants just to have quality in their life and feel comfortable in their own skin. And whether that's, going down the avenue of they have a procedure done, or, they come and see me and we work on their mindset. It's whatever you can do to make someone feel better about themselves I think it's a really special thing.
I think, your tummy is another kind of classic example in that, you have kids, some people's tummies change a little bit, some people's change a lot. And, you don't get to choose. It's just what happens. And, over the years, people said, look, you need to lose weight and you need to do some more exercise and you'll fix your tummy.
Oh my gosh, all the people that said to me, oh, just do this and just follow this program. I'm like, I've done it. I've done everything. They're not going back together.
No. And that's the reality. Obviously, losing weight's going to help. But when your abdominal wall has been stretched and your muscles have been separated, you can't fix that.
No.
An operation will fix it. But you can do 1,000 sit-ups a day, and that's good exercise, and your tummy will be strong, but you're still going to have a big bulge and you're still going to have some extra skin. And you can't fix those without an operation. Yeah. You do an operation, and as you found out, your tummy's strong. Core is strong, helps with back pain. It helps with so many things. And you can wear normal clothes, you can wear a bikini. Yeah. And you're happy, which is really the goal. The goal is big.
Yeah, absolutely. Very happy. You have one very happy patient here. Well, thank you so much for your time today. Like I said, I really appreciate you're a busy person. So thank you for sharing some insight. And I will be posting links to your practice and where people can reach you if they are interested in reaching out and having a consult.
Fantastic.
Thank you so much.
Pleasure.
Thank you so much for listening in. If you enjoyed it, please share it. Don't keep us a secret. Please share the Amy Hair podcast with everyone you know. If you have any questions about our guest today, then please look for the links and reach out to them, and have an amazing day.